Prevalence rate measures to answer both old and new cases. Only the susceptible person, both point and period prevalence. False answer. Only the new cases, only the old cases. Macromolecules include to answer carbohydrate, lipid, protein. False answer zinc, iodine. Essential fatty acids are true answer linolenic acid, arachidonic acid, linolenic acid. False answer palmitic acid, is stearic acid. Essential amino acids are true answer tryptophan, phenylalanine, arginine, methionine. False answer tyrosine. Prevalence rate measures true answer both old and new cases. Only the susceptible person, both point and period prevalence. False answer only the new cases, only the old cases. Macromolecules include true answer carbohydrate, lipid, protein. False answer zinc, iodine. Polyunsaturated fatty acid present in true answer coconut oil, sunflower oil, soybean oil, palm oil, mustard oil. এছাড়া আছে safflower oil, corn oil, sesame oil, groundnut oil, mustard oil, palm oil. Safflower oil, corn oil, sunflower oil, soybean oil, sesame oil, groundnut oil, mustard oil, palm oil, coconut oil. Latent inclusions in community health include true answer doorstep services. False answer felt need of the people, economic empowerment, investment in health, community participation. Magnitude of preventable mortality is indicated by true answer life expectancy at birth, child mortality rate, infant mortality rate. False answer proportional mortality rate is a part of the whole mortality. State social dysfunction is known as true answer sickness. False answer disease, illness, disability, severe state of morbidity. Tertiary level prevention includes true answer disability limitation, rehabilitation, social intervention. False answer chemoprophylaxis, health promotion. Severity of illness is indicated by true answer attack rate, prevalence rate, incidence rate. False answer case specific death rate, case fatality rate. Danger signs for under 2 months children are true answer high fever, not able breastfeed. Convulsion. False answer fast breathing, frequent vomiting. For age 2 months to children, it is not able to drink, convulsion, abnormally sleepy or difficult to wake, stridor in a calm mind, severe malnutrition. Less than 2 months, stopped feeding well, convulsion, abnormally sleepy or difficult to wake, stridor in calm mind, wheeze, fever or low body temperature less than 35.5. Adverse effect of maternal malnutrition are true answer toxemia of pregnancy, postpartum hemorrhage, low birth weight. False answer neonatal hypothyroidism, hydramnios. Preventable factor present in colostrum are true answer IgA antibody. False answer vitamin D, carbohydrate, sodium, minerals. Population policy formation requires true answer size of the population, fertility rate. False answer distribution of the population, age ratio, density of population. High fertility rate in Bangladesh is due to true answer early marriage, low literacy rate, poor health awareness. False answer high density of population, poor health facilities. Demography includes true answer fertility, migration, mortality. False answer fecundity, morbidity. Vital statistics include birth, marriage, death, social mobility. False answer migration. Social mobility includes true answer marriage, rural to urban movement, change in change in income state, change in social status. False answer marriage, change in political ideology. Social mobility includes rural to urban movement, change in income state, change in social status. False answer marriage, change in political ideology. Management is a mixture of science and arts, a synonym of administration. False answer completely science, completely arts, rules oriented rather than output. Administration is to answer orderly application of routine procedure concerned with encouraging efficiency, more applicable in root level organization concerned with encouraging effectiveness, false answer output oriented rather than rules. Disease transmitted vertically are to answer AIDS, hepatitis B, toxoplasma gondii, false answer tuberculosis, measles. Features of experimental study are to answer manipulation, randomization, false answer control, hypothesis formulation, restriction. The portal of entry for tetanus pathogen are to answer excoriated skin, open wound, false answer oral mucosa, conjunctiva, gastrointestinal tract. The HIV virus is synergistic with to answer Epstein-Barr virus, cytomegalovirus, Epstein-Barr virus, cytomegalovirus, herpes virus, papilloma virus, mycobacterium tuberculosis. Common drugs used by the drug addicts are to answer stimulant, sedative, narcotic, analgesic. Drawbacks of retrospective studies include to answer common drugs used by the drug addicts are to answer stimulant, sedative, narcotic, analgesic, false answer laxative. Drawbacks of retrospective studies include to answer loss of data, incomplete data, false answer long duration, excessive use of manpower, high cost. Live vaccines are to answer BCG vaccine, measles vaccine, oral polio vaccine. False answer cholera vaccine, hepatitis vaccine. Qualitative variables include to answer a satisfaction of the client, occupation of the respondent, socio-economic status. Satisfaction of the client, occupation of the respondent, socio-economic status. False answer age of the patient, temperature of the patient. Measures of dispersion include to answer mean deviation, variance, range, false answer percentile, mode. Dispersion ভিতরে range, variance and standard deviation, coefficient of variation, quartile deviation, or the range, the mean or average deviation, standard deviation. Drug dependence is characterized by the to answer withdrawal symptoms, dose response relationship, repetitive use of drug, behavioral disorder, false answer compulsion for drug. Motivation includes the following stages. All answers are false: interest, trial, error, decision making, evaluation. Stage of motivation: initiation, direction, sustained behavior. Stage of adoption: awareness, evaluation, trial, adoption. Behavioral science deals with the following behaviors to answer: good behavior, bad behavior, overt behavior, aggressive behavior, covert behavior. As a process, communication is to answer interdependent two-way. False answer one-way, reciprocal feedback independent. As a process, communication is interdependent two-way. As a process, communication is interdependent two-way. False answer one-way, reciprocal feedback independent. New concept of prevention includes primary prevention, primordial prevention, secondary prevention, tertiary prevention. False answer specific prevention. The objectives of health education are informing people, imparting knowledge, motivating people, developing skills, guiding into action. The principles of primary health care are to answer equitable distribution of health resources, equitable health service delivery, community participation, multi-sectoral collaboration. False answer suitable participation. The measurements of morbidity are to answer incidence rate, prevalence rate, false answer case fatality rate, survival rate, and standardized rate. Most common types of occupational cancer are to answer lung cancer, leukemia, mesothelioma, cancer of urinary bladder, false answer laryngeal cancer. আচ্ছা laryngeal cancer true হবে. Most common type of occupational cancer are to answer lung cancer, leukemia, laryngeal cancer, cancer of urinary bladder, false answer mesothelioma. Highest relative contributors to the greenhouse effect are to answer carbon dioxide, false answer N2O, CH4, ratio to CFC. The waterborne diseases include to answer poliomyelitis, dental fluorosis, giardiasis, Wells disease, false answer kala jar. Functions of district public health nurse are to answer supervise nursing service of the district, manage critical patient during NID, teaching of the nursing student. False answer participate in planning activities in civil surgeon office, cleaning audit in district Sadar hospital. Fails principles of management are to answer unity of command, unity of direction, false answer unity of commitment, unity of progress, unity of human resources. Health resources are to answer media, health market, merit, health goal, motivation. And components of epidemiology are to answer disease frequency, distribution, determinants, false answer, environmental, sanitation, health promotion. A cross-sectional study measures true answer in prevalence, exposure and outcome simultaneously. Odds ratio, false answer, incidence, relative risk. Most common biases in case control study are to answer interviewer bias, false answer, selection bias, recall bias, observation bias, measurement bias. The analytical study is concerned with to answer testing of hypothesis supporting the descriptive study, determinants of disease, false answer, distribution of disease, formulation of hypothesis. Objectives of surveillance are to answer epidemic prediction, estimation of future disease impact, false answer, epidemic detection, confirmation of endemic, periodic health examination. Characteristics of cohort study are to answer proceeds from cost to effect, relatively expensive, large sample size is required, false answer, suitable to find out the cause of rare disease, measures cross product ratio. Characteristics of cohort study are to answer proceeds from cost to effect, relatively expensive, large sample size is required, false answer, suitable to find out the cause of rare disease, measures cross product ratio. Features of case control study include to answer indentation of risk factors, suitable for a study of rare diseases, false answer, estimation of incidence rate, requires large project, suitable for a study of rare exposure. Prospective study can measure attributable risks, relative risks, incidence rate, false answer, cross product ratio, odds ratio. Contagious diseases include to answer leprosy, scabies, trachoma, false answer, malaria, tuberculosis. Incubatory carriers include measles, false answer, tuberculosis, influenza, cholera, hepatitis. Incubatory carrier, measles, mumps, polio, pertussis. In the contraindication of live vaccines are to answer leukemia, corticosteroid therapy, pregnancy, false answer, administration of another vaccine, autism. Features of screening test include based on few specific criteria, not a basis of treatment applied to groups, false answer, test results are final, very accurate. Advantages of DOTS for TB are to answer low cost, lower failure rate, reduced drug resistance, TB bacilli decreased morbidity, false answer, rapid bacterial conversion. Gaps in natural history of chronic disease are to answer indefinite onset, long incubation period, absence of known agent, multifactorial causation, false answer, short latent period. Disease prevented by pentavalent vaccines are to answer pertussis, hepatitis B, haemophilus influenza type B, false answer, poliomyelitis, measles. Pentavalent vaccine, diphtheria, pertussis, tetanus, hepatitis B, haemophilus influenza B. In the measures of central tendency include to answer median, mean, mode, false answer, and standard deviation range. The measures of central tendency: mean, arithmetic, weighted, geometric, median, mode. Inorganic dusts are to answer silica, asbestos, coal, false answer, cotton, cane fiber. Disease transmitted by Aedes mosquito are to answer dengue, Rift Valley fever, chikungunya fever, false answer, Japanese encephalitis, Q fever. Yellow fever, dengue fever, chikungunya fever, Rift Valley fever, pyellaria. Disease transmitted by Aedes mosquito. Pneumoconiosis is caused by to answer coal dust, asbestos, silica, false answer, chromium, cadmium. Zoonotic diseases include rabies, plague, false answer, epidemic typhus, salmonellosis, giardiasis. Vitamin D deficiency disorders are rickets, osteomalacia, false answer, scurvy, osteoporosis, osteoarthritis. Models of health education include medical model, social intervention model, false answer, health promotional model, environment interventional model, behavior change communication model. Getting to zero declaration by UN in relation to HIV or AIDS includes to answer zero new infection by 2015, zero discrimination by 2015, zero AIDS related death by 2015, false answer, zero new infection by 2020, zero AIDS related death by 2020. Tuberculosis is a communicable disease, bacterial disease, false answer, emerging disease, viral disease, subclinical disease. In a series 2, 4, 8, 5, 7, 10, arithmetic mean is 6. False answer, geometric mean is 8, median is 6, range is 10, mode is 7. Qualitative data are presented by the following: true answer pie diagram, bar diagram, false answer histogram, frequency polygon, line diagram. Diagram ভিতরে bar diagram, simple compound, multiple, pie diagram, pictogram, pie diagram or sector, pictogram or picture diagram, map diagram. গ্রাফের ভিতরে হিস্টোগ্রাম, ফ্রিকোয়েন্সি পলিগন, ফ্রিকোয়েন্সি কার্ভ or normal distribution or Gaussian distribution, scatter or dot diagram, scatterogram, line chart or graph. Basic epidemiological tools are rate, proportion, ratio, false answer, percentile variance. Indicators included in physical quality of life index in are true answer adult literacy rate, false answer per capita GNP, maternal mortality rate, under 5 child mortality rate, morbidity rate. Relative risk denotes true answer risk ratio, incidence rate, false answer odds ratio, population attributable risk. RR is incidence of disease or death among exposed, incidence of disease or death among non-exposed. Bloodborne diseases are true answer hepatitis D, malaria, syphilis, false answer ankylostomiasis, amoebiasis. Soil is a reservoir of the following diseases, true answer tetanus, ankylostomiasis, amoebiasis, false answer poliomyelitis, Nipah, encephalitis. The vaccine preventable diseases, true answer hepatitis C, hepatitis A, hepatitis B, false answer hepatitis D, hepatitis C. ভ্যাকসিন দিয়ে প্রিভেন্ট করা যায় হেপাটাইটিস এ, বি আর হচ্ছে ই, আর ডি আর সি এর কোনো ভ্যাকসিন নাই। Hospital acquired infections are true answer hospital cross infection, nosocomial infection, false answer opportunistic infection, waterborne infection, contagious disease. Approaches to healthcare financing management are true answer setting targets to achieve goals, false answer balance between needs and resources, use limited partnership, ensure maximum productivity, improvement of occupational process. Biological waste are collected in yellow bag, false answer green bag, blue bag, red bag, black bag. Most vital indicators of MDG are true answer maternal mortality ratio, false answer total fertility rate, infant mortality rate, adolescent pregnancy rate, contraceptive prevalence rate.